Yes, go ahead.
Okay. So good morning. I'm Peter Gourlay, RMI Vice President and Manager of RMI's Energy Program. I'd like to thank everyone here who's taken the time to join us for the webinar on ensuring better airflow at manufacturing facilities to reduce the spread of COVID-19. In addition to our expert speaker who's going to be joining us shortly, Larry Schoen, I thought you'd like to know who all has registered for this webinar, who will be on, either is currently on or will be on shortly. We have 10 manufacturers registered today from RMI's Energy Program, as well as engineers from the Baltimore County school system. And we've invited them because they're RMI's involved with BCPS, and they too are looking at a lot of these same airflow issues for their facilities. We have representatives from RMI and regarding today's format, you'll hear from our guest speaker, Larry Schoen, who's a principal engineer of Schoen Engineering for about 20 minutes, and then we will open up for Q&A for the remainder of the program. And as it relates to Q&A, if you've got questions, please enter them into the chat function, which you'll see as you scroll towards the bottom of the screen. You can enter them at any time. So just a little bit of background, again, on why we're actually doing today's webinar. RMI's President Mike Galiazzo was on the Governor's Task Force on Best Practices for Reopening Manufacturing. And one of the key considerations for best practices related to COVID-19 was ensuring there was good outside airflow at manufacturing facilities. RMI recognizes from its work with its existing manufacturers that there may be concerns related to appropriate airflow ventilation in the facility work areas, as well as office areas and break rooms. So given the pandemic and the variety of issues that need to be addressed, RMI is engaged an international expert in Larry Schoen, from principal engineer at Schoen Engineering and a fellow of the American Society of Heating, Refrigeration, and Air Conditioning Engineers, otherwise known as ASHRAE, to help address some of these concerns today on this webinar. So before we begin our program, I'd like to take the opportunity to thank the Maryland Energy Administration for its partnership on our energy and efficiency program for manufacturers in the Delmarva Power and Pepco territories, and thank the MEA team who's online today, as well for being here to discuss MEA resources to help manufacturers during our Q&A. And now let's dive into the program. Just a short introduction. Mr. Larry Schoen is an internationally recognized expert in indoor air quality who served on the committee that wrote the most recent version of ASHRAE's position document on airborne infectious disease. He will provide insights on what facility managers should review regarding the setup of their current HVAC operations. So Larry, that's all yours.
Good morning, and thank you everybody for joining us. Just a little more background that I do consulting now, and clients include industrial clients for industrial ventilation, and also MICA. Art schools need some of the similar kinds of ventilation. But I also want to share that I was home office support for engineering operations at the rails company for 10 years. So we didn't have manufacturing, but we had a lot of building operations of all different types. So I have a warm place in my heart for people who are out there in the field trying to keep buildings running. And we haven't, at ASHRAE and some of the subsets of ASHRAE committees, this has not been something we just started thinking about. We've been looking at indoor air quality, aerosols, meaning those tiny particles that stay airborne and sometimes can be infectious, and looking at healthy and sustainable buildings for a long time. This is some of my background. It's kind of fun to look back at what I've written in the past. Not to say I told you so, but there is some perverse pleasure in that, but also to emphasize that we haven't just started to think about this. So here's a document from 2014 when a rewrite of our position document on infectious disease just came out. And those of us, not just myself, but anybody in disease spread knew that we were going to get hit with something at some time. There's just been too much history in the world to think that all of a sudden history would stop. Three pandemics over 100 years from influenza has been the pattern. And so this is another book that I wrote for BOMA. BOMA is building owners and managers. They tend to focus on perhaps light industrial, but really more commercial office buildings. And of course, the economic disruption that we're facing is not unprecedented. This has happened in the past, and those of us who have looked at it have known that this could happen. So having said all that, I guess the main message of my talk is that it's the absence of a decent HVAC system that has been associated with some of the recent spread of disease that has been found and studied by researchers in this current pandemic. So, you know, the HVAC system, if you have one, and if it's got a decent amount of outdoor air dilution ventilation, and it's got decent filtration, and more about what that means later, then it's not likely that the HVAC system itself is going to pick up infectious disease in the return air, run it through the coils in the systems, dilute it with outdoor air, run it through filtration, and then deliver it to somebody and infect somebody. Not to say that this couldn't happen, but none of the recent studies have shown that this is a primary means of disease spread. It's really the absence of a system. So as it says here, it's going to take years until there's a consensus. Researchers do a lot more, and there's a consensus about what the disease transmission mechanisms are. But I'll say it again in my last bullet in another way, that it's the absence of a minimal system that has allowed disease to spread. So let's take a look at a couple of cases that have been well studied and that have gotten our attention. These relate to a couple of buses. Now you look at the dates, January 19th, this was very early in the pandemic in China. So researchers were able to trace back disease and know with reasonable certainty that there was only one person who came on bus number 2 who was infected. And this person on bus number 2 is shown here in the center. And you can see from the number of seats, these buses in China are quite a bit more crowded than what we're used to in our North American buses, 3 on one side and 2 on the other. They hold, I forget the exact number, but I think they hold up to 70 or maybe even more. A typical North American bus is more like 55. So very densely occupied and very little ventilation. I actually corresponded with the author of this paper at the University of Georgia and asked them, could they possibly go back to some of these buses and measure what the real ventilation rate was, and actually take it on the same trip and try to measure that. Haven't heard back from them, but that would be really useful. So what was notable about this was on bus number 2, 23 people got infected from this one index patient. And you can see from the lightly shaded pink sections that many people who were infected were not right next to the person. So that's very notable. And comparing it to bus number 1, where there was no index patient of infection, nobody got infected, including 150 people who went to the same 150-minute worship event. So this told us pretty clearly early on that disease could spread in a densely occupied, poorly ventilated space, and it in fact did. Here's another case. You've seen this reported probably in the popular press. Similar date. This was the Chinese New Year. So if you can imagine people in there celebrating, perhaps singing, perhaps yelling and boisterous. More about that later in manufacturing facilities, something we want to avoid. But this shows only a portion of the restaurant. And again, there is an HVAC system on the right here. It has no outside air. It's purely recirculating. It's one of these mini splits, so it has almost no filtration. It has that little washable screen on it. And in this case, the researchers were able to measure 1.5 to 2 CFM per person. So in our North American codes, we call for, depending on which code version, probably something around 8, 10, 15, maybe even 20 CFM per person. So here you see very, very poor ventilation. This is what makes me say it's the absence of a decent system that allows the disease to spread. So at the same table with the infected person in that family, 4 others were infected. At the adjacent tables, 3 on the table on the left and 2 on the table on the right. What's also notable is that none of the servers or none of the other 68 patrons were infected. So if you have this system circulating the same air in this area, not even filtering it, that is notable. And the servers, even though they went right in and they were, handing dishes, taking away dishes, touching what the patrons who were infected touched, they did not get infected. So this tells us something else useful. And there's more evidence, not just from this study, that there is a dose-response relationship. What does that mean? That means that you need a long time of exposure to, not that nobody wants to get infected, but to get infected, you need a longer term of exposure. So that's good news. That says if we can avoid long contact in densely occupied spaces with poor ventilation, that will hopefully be protective if we avoid that. Just because you get exposed does not mean you're going to get it. There's mystery there that when I say we, I mean even researchers in virology and do not know why some exposure leads to infection. Why did 23 people on the bus get infected and not all of them? We don't have good answers for that. So there is still suspicion of direct person-to-person contact. We want to avoid that with people whose infection status is unknown. We want to avoid the contact with the inanimate object, these frequently touched surfaces that you've heard a lot about. And we want to avoid the close contact. My colleague Yugo Lee in Hong Kong makes the point that at 1 to 2 meters, which is 3 to 7 feet, that it may not just be a large droplet that goes from me to you. It may be the greater concentration even of those small particles in the cloud that we'll see more about this in a moment, that can spread like a gas more at a higher concentration between me and you when we're at close proximity. So the HVAC system can only help for the last 2 bullets. So that's why I say that the HVAC system plays a small role as long as you have a decent one that is not allowing concentration to happen. Well, this is a photo from the London transit system in 1918. Even in the 1918 influenza pandemic, which killed millions worldwide, systems for transit and buildings remained in operation. There are certain things that are considered essential. So this lists some of these strategies that are used to try to prevent disease spread in these systems that have to remain in operation. So let's look here. You have a person, you see the cloud spreading here and transmitting directly to another person. We have the possibility of it going a longer distance to the person on the right. And the fomite, that's a fancy word for these frequently touched surfaces where disease can spread. If I touch it, I just cough on my hand and I touch it, and you come along and unknowingly touch it, and then unknowingly touch your mucous membranes, that's a chance for direct spread. So what can people do? Well, that's why we keep saying the 6 foot. And actually, if you do a real unit conversion, 2 meters is 7 feet, but these are not exact sciences. These are rules of thumb. So 6 feet, 7 feet. And wearing a mask can prevent this kind of spread of the plume from the person on the leftmost of this diagram. And then the long range, dilute and ventilate and filter, that's what the HVAC system can do. And mostly not to have no, I keep repeating this, avoid having no HVAC system. So if we don't know the route of disease transmission, what the heck are you supposed to do in building operations? Well, the answer is you unfortunately have to do everything. In hospitals, they call that, in the last bullet, infection control bundles, where you bundle together a number of measures because you don't know which mechanism is going to be the one that could cause spread. And I do hate to say this, but from a liability point of view, if you haven't taken one of the recommended actions and somebody does get sick in your facility, of course somebody's going to come along later on and second guess and say, well, you didn't do this measure in the building, so therefore that's what's caused it. We can't know for sure, but that's why it's good to take all the measures. Whoops, did I repeat a slide here? No, I'm just going backwards. Let's do this right. So ASHRAE does have some reopening guidance on its website. I don't agree with everything that ASHRAE has said in this current time. They say things, for instance, like go around and open all the windows, or they did say that. I haven't checked the latest. And that's not always practical to open and close windows all the time. It's not necessarily practical from a comfort point of view. And I don't always agree with everything the CDC is saying. We're probably emphasizing more than the CDC these elements of what you should do in your HVAC system. So I go along with what Bill Bonfleth said as a presidential member, meaning he's a former president of ASHRAE. He's studied airborne infectious disease like a lot of us have, and he's studied some other areas. And he says, just make sure you've done your maintenance. That's really key. Make sure you've got a system that's running. Do you know that all your systems are actually turned on? Do you know the outside air dampers are really open and delivering what they're supposed to? Do you have any way of verifying that with air balancing equipment, or can you get someone in to do that? Do you have some flow hoods to make sure that the diffusers in the ceiling are really flowing air, that a fire damper hasn't shut, that a duct hasn't been clogged up with debris? So are you sure your system is running? Are you doing the proper filter changes and getting the outside air in there? So let's dig a little deeper into the strategies. If you have, I doubt if you have this in manufacturing, but commercial buildings sometimes have energy saving controls that reduce outside air. Well, that's a good idea for non-pandemic periods, but right now we're trying to save lives and save disease spread. We're not trying to, we are trying to save energy, but our focus is less. Right now, the focus should be on protecting people. And that means disabling these controls. It's sometimes based on carbon dioxide. In this climate, unless you have a system which is designed for 100% outdoor air, and sometimes industrial systems, like in a wood shop, are designed for 100% outdoor air. You can't recirculate the potentially explosive dust-laden air from a wood shop. So sometimes these systems can deliver outside air, but most cannot. So if you can't, then the trick is to make sure you have at least some dilution with outdoor air, and that the mixture of outdoor and return air is filtered. For central systems with any kind of pressure ability, I've yet to find a system that cannot handle a MERV 13 filter, and usually you can go higher. Sometimes people worry, I can't upgrade my filtration because I don't know if it can handle the pressure drop. I have yet to see a system by calculation or by observation that can handle at least MERV 13. Now those little split systems, those mini splits, they can't. But a central system with a 1-inch filter drop, I believe they can all handle it. Keep them running longer hours. What do we mean by that? Well, I would try to get the system running at least an hour prior to occupancy. And if you're going to have any kind of occupancy past the peak, try to keep it running while people are in the building for the entire time. And if for some reason, this is really going to apply more probably in the winter season. If it's too cold, you can't run it for an hour in the morning. So at least run it for some time in the afternoon when the outdoor air is a little warmer. This last bullet, I do know that I talked to a dental practice just the other day, and they're using portable room air cleaners with HEPA filters to try to get the room air to be cleaner. I don't know if that will work in some of your facilities, but it could. I'm going to go quickly through some of these slides because I know we have a limited amount of time, and I want to leave time for some dialogue, for you to ask questions and for us to have some sort of dialogue. And by the way, queue up those questions now, because I think you can submit them in the chat screen, and you can also have them ready to go. So this really says in another graphic what we've already said. The larger droplets fall to surfaces in the ground in a relatively short distance, and the smaller ones spread over longer distance. Let's not get hung up on the exact size particle. Not that you folks would, but people sometimes say, well, what's the size demarcation? Depends on who you ask, and there's no hard and fast rule. It's somewhere between 2.5 and 10 microns. Here's another graphic which demonstrates it to you, and here you see somebody sneezing, the results of somebody sneezing. I don't know if this is Schlieren photography, but there are mechanisms for capturing this that researchers can use, and they have actually Don Milton, who's at the University of Maryland in College Park. He has a sneeze lab, so he might have been responsible. Well, this one is from JAMA, but he does this kind of thing too. So we know that a sneeze can do it, but we also know, I don't know if you heard about the unfortunate incidents in Washington State early on, where even though they were spread in Seattle, they were 100 miles from Seattle, they figured they were pretty safe. They had a choir event with, unfortunately, some elderly, vulnerable population, and they were all singing next to each other. Nobody was symptomatic, and they had quite a bit of disease spread, and sadly, 2 people at that gathering died. So singing, certainly yelling, talking loudly at a close distance. So in industrial facilities, we encourage electronic communication. Use walkie-talkies. Don't yell at each other if you have loud machinery. You don't want to cause this kind of plume to infect each other. If you have a good hand signal system, certainly don't want to compromise safety. So the messaging has to be clear. But if you can do it with sign language, that would be great. So the HVAC organizations have been very conservative in some of their positions. As I said, I don't agree with with everything that they say, but they've taken some very conservative. So this gives you in text what I've already told you orally, and what you've looked at on pictures. 2.5 to 10 microns is where the size demarcation depends on whom you ask. Now, if there's a plume and I direct it at you, then it doesn't decrease to the inverse cube power. But if I'm just breathing and you think of a sphere is 3-dimensional, so therefore the concentration decreases inversely proportional to the distance. So maintaining distance is good. I want to give you an idea of sizes if you haven't already seen something like this. Here's a human hair, the big fat, and the Slime beach sand, the big fat particle. The blue droplet is 10 microns. The red one is 2.5 microns. So try to remember those numbers in your head, because I'm going to show you a chart in a second. But this gives you an idea. It's very small. So let's go down to the MERV 13 line that I told you about. It's on the left-hand side, close to the bottom of the chart. And follow your eye across this chart from MERV 13. Go to the right, and you'll see that in the 0.3 micron range, greater than 75% removal from this filter. As you get into the larger particles, remember it was 2.5 to 10. As you get into the larger ones, you get over 90% removal. That's why we're saying make sure you have a MERV 13 or minimum filter. You can see at the smaller ranges, sometimes you don't even have a measurement value for the smaller particles, or it gets much, much lower in terms of removal. Now, this virus itself is 0.12 microns in diameter, but the virus never travels alone. It's traveling in a particle of mucus and salts and water, and and these larger particle ranges, even when it's airborne. So that's why we say use the better filters. We also say don't turn off your system. In the early days, some areas in China were saying turn off the system, or even maybe the WHO, I can't remember. Now, if you have a really crappy system with no filtration and no outside air, and all it's doing is recirculating contaminated air in a small space, maybe. If you have had people infected, or you know somebody has already showed up with symptoms, maybe you get everybody out of there and you disinfect the system and don't run it then. Or if we don't have it here, but if you had a wildfire event all of a sudden, or something outdoors, then you might shut it down. Please don't use ozone generators, and I get several questions a week about ion generators, plasma, airborne hydrogen peroxide. We know very little about the long-term efficacy of these systems. Even though some of the manufacturers have done some limited studies, there are no industry standards to compare them to, and I have rarely, if ever, seen a truly independent third-party evaluation of these systems. And even if there is, there's not an industry standard to evaluate them against. There are some advanced techniques like ultraviolet. Ultraviolet can be used inside a duct system, but it requires very careful sight. It requires a high intensity of ultraviolet light. It requires avoiding the frequencies and the wavelengths of radiation that could cause ozone. And it involves shining a high enough intensity over a long enough dwell time to get a decent kill rate in an air handler. So those can be done, but they require very careful design. Same with the upper room. This can be applied and has been applied in healthcare occupancies. I'm not aware of any industrial, very few commercial applications, but this is something we might start to see. This is a lunchroom in a hospital treating the upper reaches of the room. You see the sidewall air diffuser, and just below it, that's the ultraviolet fixture. So these are specialty applications. So I've given you, we're getting close to the end of my prepared talk, where I've given you a lot of general information that can be applied across building systems, but it helps to know the particular building and its systems to apply this general advice. As far as the risk in your occupancy, do you have a regular cadre of people showing up every day who are carefully checked, who you know are going to be honest about their system status, who are going to be honest about their exposure outside, and is their exposure low? Or do you have an unknown population of the public and people whose infection status is unknown, or you have reason to doubt what they're telling you? Is your facility densely occupied? Are people working in close proximity to each other? Or are they spread out over a larger floor? Fixed or transient, that's really what I said before. Is it a different population coming in every day, or is it more or less fixed? And how much do you know about the people? And I guess the overall proviso is we can never eliminate risk. We can only take reasonable measures according to industry standards, according to general advice, and sometimes people choose to go beyond the industry standards, but you can never eliminate. And the HVAC system, as I've tried to point out, is not the first line of defense. There are certain things you should do, but the social distancing and the wearing of masks, and the checking of your population and encouraging workers to not come in when they're infected. And there's lots out there, maybe even too much to guide you. So, so again, the HVAC system is really the icing on the cake. Make sure your systems are running, that they're doing what you think they're doing in terms of outside air and filtration. Run them before occupancy, 1 hour, 2 hours, more if you have if you know your system has very little outside air dilution and maybe not the best filtration, but it has some, and it has some of both. If it has some of both, run it. If it doesn't have any of either, get some. Okay. Improve your filtration to the level that you can, get more outside air. Consider advanced techniques such as the ultraviolet, such as the room air cleaners that I've mentioned, if you can get a hold of them. And if you have questions for follow-up, I welcome that. My email address is here, and it was on the first slide. And I'll turn it back to Peter or whoever's going to handle questions at this point.
Okay, well, thank you very much, Larry. We're really grateful that you put this presentation together. I thought it was fantastic. If you look at the chat amount of questions, we have quite a few. So, but before we get to that, and we're going to get to it very, very shortly, I just wanted to make sure the audience was aware that we have the RMI engineering team featuring Bob Barazzato and then Dini Mooley on hand. So in addition to your questions for Larry, these are two of the folks that have been working with you at your facilities. And if you have any specific questions for them in terms of follow-up, please ask those. Our RMI engineers have worked with over 40 manufacturing companies over the last 3 years as part of our state-funded program in partnership with MEA to help the manufacturers implement energy savings projects. They have worked closely with your respective utilities to access rebates and work closely with MEA to access both grant funding as well as loan funding to make these projects feasible. To date, those companies have either completed or in process of completing projects that will reduce 12.1 million kilowatt hours of energy consumption. Those are projected to save the companies 1.2 million annually. Additionally, we're delighted to have Caitlin Madera online, who currently manages the Commercial, Industrial, and Agricultural Grants Program for the Maryland Energy Administration, as well as Dave Justy, who oversees the MEA's Lawton Loan Program. So each of them represents programs that have been critical in helping to move energy projects forward in our program, as they provide both grant funding and loan funding to help drive down project costs and make these projects feasible for you. So in the back of your mind, if you're thinking you need to do any upgrades, these are tremendous resources that are available right here online. So feel free to reach out to them as we're doing our questions. So anybody that doesn't know how to submit a question, you can submit your questions just by scrolling down to the bottom where it says chat. But we've got 14 that are in links. So let's start with the questions that we currently have.
Should I just run down the list and address them as I see them, Peter?
Yes, and again, if they're appropriate for any of our friends from the RMI engineering team or MEA, to please welcome them into the response.
All right. So Bob asked, what made the large meatpacking plants vulnerable to disease transmission? I have not searched for a research study. I don't know if there's a research grade study. I actually will be curious to look afterwards. But just applying my general knowledge to what might have happened there, I suspect people are working in close quarters. I don't know if they had face protection, masks of any kind. And I suspect that there was noise from machinery that they had to yell over. And all of those are risk factors, but I will try to get a better answer to that. Are companies that don't operate their HVAC systems in accord with minimal ventilation legally liable? I'm not a lawyer, but sad to say, I do testify for lawyers sometimes. And I mean, that's one of the things I would ask of a company in the process of not deposition, what's it called? Request for production of documents. We would ask for maintenance records of what was done. How do you define a decent HVAC system? In terms of, as I said, outdoor air dilution ventilation per person. I gave some numbers there. The current codes require 8 or 10. It depends on the density in the room. 15 or 20 CFM per person is even better. And the Europeans say even better than that, even higher than that is even better. If I were running a facility and I wanted to reduce my risk, I would say at least 15 CFM per person. I would try to go higher. And the MERV level for filtration, I gave you that, is MERV 13. And I guess the other component of a decent system is that it runs for at least while the people are in there, and at least for an hour beforehand, and that that it delivers air to the room. And for instance, if there's a fire damper that got closed and a whole section of the factory floor is not getting air at all, that's a problem. So I would make sure that all the air outlet devices are getting air. Based on the China bus, would I recommend dedicated HVAC systems for sick employee rooms? I don't think sick employees should be coming to work. In hospitals, they have airborne infectious disease isolation rooms, AIIRs. If you have somebody at home who is of a known infection status or of a high-risk infection status, then we're recommending procedures like that for the home even. Try to get the overall rule, whether it's industrial ventilation or disease prevention, is air should flow from clean to dirty. You don't want air flowing from dirty to clean. So if you're trying to keep an area clean to prevent somebody from being infected, you want the air to go from that area, the clean, to the dirty. If you have an area where you know someone is infected or high risk, that's the dirty area. You want air to flow into that area and then to the outside. Recommended air change rate for manufacturing plants. Despite the fact that even in the healthcare industry, they talk about air changes per hour, for disease control, I like to speak of air of CFM per person, because suppose you have a dense room of people, if the air changes in the room doesn't really give you a clue for how that's being diluted per person. So I've given you those number minimum, even though the codes would say 8 to 10, I would be looking in my facility for a minimum of 15, which is the old code. If I could do it, if your system can't do it and you're meeting the code, then operate what you have. But I would try to get it up to 15 if I could. I mentioned several detailed recommendations on O&M. Is there a good audit checklist? Well, BOMA, okay, I'm a little biased here because I wrote a preventive maintenance manual for BOMA, building owners and managers. It's available for purchase from BOMA, BOMA.org. There are checklists in there. Your equipment manufacturers have checklists. There's an ASHRAE standard. I forget the number, but it's on operations and maintenance. Your HVAC contractors have checklists for maintenance. Or I've given you some checklists orally and on my slides. Is your outside air damper open? Do you have a MERV filter in place? How much air are you delivering? Have you measured that with a balancing contractor, or do you have your own means for doing it? ASHRAE recommends measuring it at least once every 5 years. Is air flowing to every room? Make sure nothing's closed off in terms of a damper. There's a short checklist. Manufacturers interested in upgrading to safer systems, can retrofit be completed in phases, or is it a complete replacement? I'm a cheapskate when it comes to replacing equipment. I have I worked in property operations for 10 years. We never replaced a piece of equipment based solely on age. I had 50-year-old air handlers with big shafts that we spray welded to keep them in operation and put new bearings on. And we fixed vanes of air handlers. If you can keep it clean and you can keep it in operation and you can get a good quality, good filter in there with the right MERV rating, and you can seal around the edges of the filter. I may not have emphasized that as much as I need to. If you put a high efficiency filter in, you must seal around the edges. You can use weather stripping, you can use a foam seal, you can use tight fitting, you can use a metal spring. Whatever you use, make sure there's a tight seal between the filter and the edge of the rack that it's going into. Otherwise, air bypasses around the filter, and what used to be a MERV 13 filter mixes with air that's not even filtered at all, and you get a MERV 7 filter. You don't want that. So you can do retrofits in stages. You can increase your outdoor air if you have the capacity. And how do you know you have the capacity? If you're not maintaining comfort, then you're overloading your capacity. If you're in this, as we get into the humid weather, if your facility is getting too humid, then you're not maintaining capacity. You've overloaded it. Maybe you need to taper back on the outside air. So that kind of jumps me ahead to can you get a separate system which can dilute with outside air? And the answer is yes. The problem is if you just throw in a fan with no conditioning, be aware that you'll be bringing in unconditioned air. Now, some facilities can handle that. In fact, many shops are made for, they don't have the money to fully dehumidify and cool all the outdoor air that needs to flow through. So if your shop is set up for that, yes, if you can tolerate the high conditions of temperature and humidity, then yes, bring in more outdoor air that way. Let me see if I missed any. Can be retrofitted. I think, is a break room a good application for a portable air cleaner? Yes. What is the recommended per person CFM? If you go to the manufacturer's website, there's a parameter called CADR, Clean Air Delivery Rate, from AHAM, AHAM, Association of Home Appliance Manufacturers. Doesn't mean you can only use it in your home. It's just who rates that particular piece of equipment. They have what's called a clean air delivery rate for tobacco smoke. I'm not suggesting you smoke in your facilities, please don't. But it's a rating for fine particulates, basically. So use the clean air delivery rate for tobacco smoke and size it for the room that it's sized for, and that will give you a good sizing recommendation. Those are not sized CFM per person. Get one that has a HEPA filter. HEPA filters, you may not remember these numbers, but they remove 99.7% of the 0.3 micron particles. That doesn't mean they only do those size particles. That's the particle at which they're rated. They also remove the other size particles that I showed you on the screen before. That's for the room air cleaner. Don't think you need a HEPA filter for your central air handler. Not only don't you need it, your system probably can't handle a HEPA filter, and you probably don't want to spend the money for it. The MERV 13, 14, 15, 16, if you can go even higher, depends on the thickness of your rack and what you can get commercially available. That's good enough for a central air handler. For those little room air handlers, they're trying to turn over a lot of air and do a good job in the room. Those are sized for the pressure drop to handle the HEPA filter. Face shields are a higher level of protection, absolutely. If you happen to have somebody who does or is yelling, you're protecting your whole face from that. And they divert the aerosolized particles downward. Yes, if I am emitting the particles, yes, they send them downward. I agree with everything you've said so far, Brian. how does the deployment to a workforce impact some of the recommendations I would make on HVAC and airflow? I would say you've met the recommendation for the mask by doing that. The problem is I still want some overall turnover of airflow in that room, because even though you've directed it downwards, if it's a small enough particle to remain airborne, well, it just goes down to the floor, hits the floor, and comes right back up into the room. If it's not a very densely occupied floor, then you're not going to have a lot of exposure, so that's good. But I still want some ventilation turnover in that big room. The second thing is there's surface contamination and re-entrainment from the surface. So this applies less so to a concrete floor, so that helps. But any floor can have re-entrainment, meaning people walk on the floor, and if the larger particles have been directed down to the floor and settled there, then I walk on them, I have the potential to re-entrain them. If it's a concrete floor and you don't have a lot of floor traffic, whether it's people or machines, you have less, but there's some. So, you know, has anybody modeled all of this on your particular room? Probably not. So that's why we use a bundle of control measures, and there's some judgment involved. And you might, and looking at your individual facility, as you have done, which is great, to look at where my risk is appropriate. So Bob is asking, would humidification systems help to limit disease spread during the winter? This is a big question. There is disagreement among experts about this. We have some experts saying humidify to higher levels. I do not recommend humidifying to the high levels. There is some evidence that SARS-CoV-2, the virus that causes COVID-19, survives quite well at high humidities. Survives quite well. We have some evidence. The reason I keep couching this is because all of this is based on early studies. It takes years, really, for a good body of research and for scientists to reach consensus. So that's why I'm hedging a little bit. But the preliminary evidence is that it survives quite well up to 80% relative to humidity. Nobody is going to be able to humidify to 80% in the wintertime. So many of us, myself included, are saying, don't focus on that. Focus on getting good filtration and the things we've already mentioned, dilution, ventilation. But if you're convinced that you want to be cautious and you want to do that too, some of us are saying, okay, in the very dry weather, humidify to 30% relative humidity. This is only going to come up, as the question has said, in the winter. So it's not something you're going to focus on now. Put this on the back burner for now. If you have a humidification system already installed, well, maybe you're going to consider turning it on. But please do your maintenance to the highest level. There are diseases that can be spread, other diseases that can be spread from the reservoir of water that sits in the humidification system. And there are moisture problems that can be caused in buildings from higher humidity. And there are mold and moisture issues that can cause sensitized people to have problems. And where does that problem happen? It happens in their respiratory system, the one system in the body that we do not want to compromise at this time. So humidify with great caution in the wintertime. Make sure your maintenance is impeccable and don't go too high in the humidification levels. And now everything I've said is going to increase, not everything, okay. Many of the things I've said are going to increase energy consumption. How do you handle it? I think you have to run the flag up the flagpole, and you have to warn people I had one school system say to me, "Oh, our budgets are already cut and trimmed to the maximum. We can't afford anything." Well, you better run that flag up the flagpole now, so that the decision makers on budgets are aware of the fact that running systems for longer hours with better filters and outdoor air and doing more frequent surface cleaning and doing and handling the filters. I haven't mentioned this yet. Handling the filters as they come out of the systems as though they themselves are contaminated, meaning I have a mask on for PPE when I'm taking that filter out, and I put it immediately in a plastic bag, and I get it outside as soon as possible. And if I have one of those room air cleaners and I can roll it outside before I even take the filter out, I do that. So all of these extra practices are going to cost more money, including the energy conservation. How do you handle the dilemma? The risk of getting infection, both from a societal point of view and from an employer point of view in terms of lost labor and lost productivity, and all the actions you're going to have to take in a facility after a known infection are going to be greater than the energy consumption that you're going to cause. So you have to bite the bullet is how you handle it, and let the powers that be know about it. For heated but non-HVAC manufacturing, are there guidelines for outdoor air? I think I mentioned that a little bit. You can do that. You can use through the wall fans to bring air in. I've given you some CFM per person numbers. If you can, the thing you want to be careful about is that you're not blowing air from dirty to clean. So for instance, locate that fan in a place where it's not a high contaminant area, whether those contaminants are from the manufacturing process itself or from the possibility of disease. You don't want to blow from a dirty area to a clean. So try to take the air from a clean area and inject it into a clean area in your facility, so that that clean air is getting to the other areas in the facility. I think I talked a little bit about the upgraded. There is no, I mean, there are numbers of typical lifetime of equipment. I've published some of those in the BOMA manual that I mentioned, but those are guidelines for budgeting purposes. I encourage you to look at the condition of your equipment. I've seen 10-year-old equipment not maintained. That's in terrible condition, or that's in terrible condition because it's in a corrosive environment. I've seen 50 and even 75-year-old equipment that's been in good environments and treated well, and we keep it running. So I don't find a limit on age for upgrading. As long as you can clean it, as long as you can comb heat transfer fins, and they don't crumble on you, and as long as the casing of the equipment can still be open and closed, and you can get to everything, and the filter racks are there, keep it running. Is there a specific rate of audit or add-on audit service on the types of projects expected in reaction to infectious disease prevention, i.e. upgrades, increased ventilation, or the current audit standards already look for and suggest some of these? Well, the key word here is some. Yes, the current audit standards, I don't know which standards you're using, but I do know of some that are published in ASHRAE standards for equipment maintenance. There are commissioning and recommissioning and ongoing commissioning procedures. Yes, there are some, but not all. So I encourage looking at it, having the person who's doing the audit, or having you doing the audit, or some third party involvement is always a great idea. So look at what's out there on the web in terms of CDC, ASHRAE recommendations, the things I've shared with you today. Look at the current standards that you're using, and see if some upgrades are in order. I'm not the only consultant out there who can assist. There are plenty of consultants who can assist you with evaluating this. So we have large exhaust fans. What type of air flush routine will you recommend? I've given you some guidance on airflow. If that's what you mean by air flush, I'm not sure, Nandini, if what the rest of your question is. Maybe I'll look at the next question if you want to help me clarify that. Spoke with a vendor that has installed systems using 50 to 100% outdoor air off hours to reduce utility costs. Okay, so that's a great idea. If you can do your dilution ventilation when, if, for instance, it's cooler at night. So for instance, in my home, I opened all my windows last night because it was cool. That's a great idea for flushing. But it only flushes the contaminants that are there at the time of the flushing. So if they are contaminants that are released by the building, if they're contaminants that are residual from the prior processes that happen during the day, that's great. But after you flush for a while, those are gone. That's not going to help you when you reoccupy your building and you now have process-related contaminants being released and you have people-related contaminants being released. You still need at least a minimal level of a dilution ventilation during the day. So Nandini, did I answer your question or was there more to it about the air exhaust fans and air flush routine?
I think you did, Larry. I was asking about the ones that are all on the top of large walls, and how do we take out the air from the stream and bring it to a new room through some sort of piping, tubing, and ensuring that it is cleaner air and so on. I think you covered it in the previous comments. Thank you.
Well, you did jog my memory that, the basic rule of physics and engineering is what goes out must come in. Okay, so if you're exhausting, think about where is that replacement air coming from. Perhaps you have a dedicated makeup air system that's handling it, but if you don't, think about where it's coming in from. If it's coming in through an open bay door and that's a relatively clean area that it's coming in from, fine. If it's not a clean area, then maybe you want to close that bay door and figure out another location where cleaner air can come in. Okay, so it is noon and it's time to wrap up. I'll turn it back to you, Peter, and let me know if there's anything else I can do. Peter, you're on mute, so Peter, take yourself off mute, please.
Okay, sorry about that. Well, a big thank you to Larry. You've really been fantastic today. Appreciate you answering all those different questions. Any questions that were not answered, we're going to follow up and make sure they do get answered by Larry. You do have his contact information on these slides, which we're going to be sharing with you. We'll also do a follow-up to make sure that you've got that information. We're also going to make sure that you have the contact information for both Bob Arizato and Nandini Mooley from RMI, and our partners from MEA, Caitlin Madera, as well as Dave Justy. So I really wanted to thank you so much. So what's next in terms of RMI? We do have a series of webinars that we do, and one of the next ones we have is Growing Maryland Manufacturing, very topical, coming up on, what's the date on that, Stacy? It's New Directions for Maryland Manufacturing with Arniban Basu.
It's June 30th, 11 a.m.
Okay. So the focus is going to be on what steps the policymakers need to take with respect to education, training, infrastructure, and taxation to promote a more rapid manufacturing growth in Maryland in the years ahead. So if you're interested in that, please visit the rmiofmaryland.com website for more details. thank you all for joining us today. I hope this has been useful for you. I know it's been useful for us. And we will be sending back the slides. And there is a recording of this event as well. We'll make that available because there was a lot of information covered here. Just a wealth of knowledge, Larry. Just a big applause. Well done. Thank you.
Thank you, Mike. My pleasure.
Okay.